Now coming to other conditions, we have brow ptosis. Ptosis is nothing but displacement or drooping. Here brow will refer to there is actually displacement of the eyebrow, whereas in a blepharoptosis, here there is displacement or there is downward hanging of the eyelids, which is blepharoptosis. So what happens, these conditions will cause falling down of these structures, and this hampers the visual field will be affected by such anomalies. So when they are going to do for blepharoptosis is a tarsal plate repair. So that can be done via a tarsal plate, and that plate in the sense again a structure, a piece of it. So they can do a wedge resection of the tarsal plate, plus they can also take something called like a banked fascia. They can accumulate this fascia. We have this fascia lata, which is a special fascia of the thigh. So they accumulate this fascia and they try to repair it. Or by way of resecting this Muller muscle, we have this congenital muscle. By way of resecting or cutting these muscles, they are also treating blepharoptosis.